Do you have an oversized prostate that's causing uncomfortable and concerning symptoms? You're not alone. The reality is that millions of men worldwide have an enlarged prostate. But did you know there are nutrients to help address that? And consuming foods rich in those nutrients can help you get back to feeling like yourself again. In this video, we're going to tell you all about the nutrients you can take in order to shrink your prostate size and reduce your symptoms of an enlarged prostate. We'll explore the science behind why these particular nutrients are effective and the best sources for it. So stick around if you want to learn more about how certain nutrients can help with your prostate size. Before we get to it, you should know that we are not medical professionals. We're sharing this video for educational purposes only, not as medical advice. So, if you feel like you have a medical condition, make sure to reach out to your doctor. That said, let's first get to know more about benign prostatic hyperplasia, which is typically known as BPH, or prostate enlargement. Now, the prostate gland is a key player in reproductive function. You see, it's responsible for producing the fluid that nourishes and helps transport sperm during ejaculation. The reality is that BPH is a pretty common condition that often affects men as they get older. It happens when the prostate gland, which is right below the bladder and surrounds the urethra, starts to get bigger. This then puts pressure on the urethra, causing a bunch of symptoms that can be bothersome for guys. Some of these symptoms might include trouble starting to pee, going to the bathroom a lot especially at night, weak urine flow, and feeling like your bladder isn't completely emptying. Men with an enlarged prostate might also experience pain and discomfort, often around the abdomen, pelvis, and perineal area. This condition mainly affects guys who are 50 and older. And studies show that almost 90% of men aged 80 years old and up experience some degree of prostate enlargement. It's really important to understand that even if a condition seems common, it should never be taken lightly. You see, if BPH goes untreated, it can lead to complications like prostatitis, which is the inflammation of the prostate gland, and urinary tract infections. And sometimes, having an enlarged prostate can also raise the chances of getting prostate cancer. But what causes BPH in the first place? When it comes to the development of BPH, hormonal imbalances, especially an excess of anabolic hormones, are believed to play a role. In particular, imbalances in testosterone, estrogen, and DHT, or dihydrotestosterone, are said to contribute to the enlargement of the prostate. Other factors like obesity and medical conditions, such as diabetes and heart disease, can also increase the risk of developing BPH. Some medications, like antihistamines for allergies and diuretics for blood pressure, are said to also contribute to prostate enlargement in certain men. The process of aging also plays a role in this matter. As we get older, our stomach acid tends to weaken, and this can affect how well we absorb important nutrients that are crucial for a healthy prostate. Also, did you know that certain foods and drinks can have an impact on prostate health? When we consume too much refined food like processed grains, sugar, and flour, or non-organic food with chemical pesticides, it can mess with our hormone balance and even harm our liver. These factors can contribute to prostate enlargement. And watch out for dairy products too. Avoid consuming too much of it because they contain high levels of prolactin, a growth hormone that can make BPH worse. Now that you know more about the condition, let's now talk about how you can get an enlarged prostate to shrink to its normal size the natural way. And the key lies in the following nutrients. Number 1, vitamin D. This vitamin is really important for reducing inflammation in the prostate gland, regulating cell growth, and keeping hormones like testosterone in balance. All of these things are super important for prostate health. And you know what? Lots of studies have found a link between low levels of vitamin D and a higher risk of prostate enlargement and prostate cancer. If you want to amp up your vitamin D levels, soaking up some sun is the easiest and most budget-friendly way to go. But remember, too much sun can damage your skin and up the risk of skin cancer. So be smart about it. Keep an eye on your sun time and take precautions like wearing protective gear and slathering on some sunscreen. It's also a good idea to add foods that are packed with vitamin D to your diet. Some examples include egg yolks, fatty fish, and fortified foods. You can also take supplements if you're not getting enough vitamin D through your diet or sun exposure. Just so you know, the recommended daily intake for vitamin D is typically around 600 to 800 micrograms. Number 2. Beta-sitosterol. This nutrient supports prostate health by inhibiting 5-alpha reductase, the enzyme that's responsible for converting testosterone to DHT. If you remember, this is one of the hormones that's linked to prostate enlargement and its related symptoms. To up your consumption of beta-sitosterol naturally, you can try including a variety of seeds, nuts, veggies, and fruits in your daily meals. Nuts like almonds, walnuts, and pistachios are great choices. Both pumpkin seeds and sesame seeds are also packed with beta-sitosterol. Fruits like avocado and grapefruit also have this beneficial compound, and veggies like Brussels sprouts, broccoli, and spinach are awesome options to include for their beta-sitosterol content. While it's true that you can get beta-sitosterol from certain foods, like those we just mentioned, it might not be enough to get the health benefits you're looking for, especially when it comes to BPH. That's when a beta-sitosterol supplement can come in handy. Just keep in mind that the daily dosage of beta-sitosterol extract that's often recommended for promoting prostate health is typically between 60 to 130 micrograms. Number 3. Pygium. Pygium is an herbal supplement that comes from the bark of the African cherry tree, scientifically known as Prunus africana. This tree's bark is packed with all sorts of good stuff like fatty acids, phytosterols, and triterpenes. And these compounds are believed to be really beneficial for your prostate's health. Some research also suggests that Pygium might be able to help with symptoms related to an enlarged prostate, like having to pee a lot and having trouble peeing. It's thought that the bioactive compounds in Pygium might help bring down inflammation and keep your prostate healthy. While we still need more studies to fully understand how Pygium works in addressing prostate-related issues, including BPH, the early results are pretty promising. If you want to try Pygium for shrinking your prostate, you can take between 100 to 200 milligrams of Pygium extract every day. Just make sure to divide that into a few doses throughout the day. Number 4. Saw Palmetto. This natural herbal supplement has a long history of promoting prostate health for centuries. Saw Palmetto has been proven effective in relieving symptoms like weak urine flow, frequent urination, and incomplete bladder emptying, which are all symptoms of an enlarged prostate. One of the ways saw palmetto works is by inhibiting the production of 5-alpha reductase, which is responsible for converting testosterone to DHT. And if you remember, DHT is one of the hormones that can contribute to prostate enlargement. So by blocking the 5-alpha reductase enzyme, saw palmetto is said to help reduce the size of the prostate gland and improves urinary function. Overall, it's a great option for maintaining prostate health naturally. To keep your prostate healthy, it's generally suggested to take a daily dose of saw palmetto extract ranging from 320 to 480 milligrams. Just remember, like other natural supplements, the effects of saw palmetto might not kick in right away. It could take a few weeks or even longer for you to start noticing improvements in your prostate health. Number 5. Zinc. Did you know that zinc is a crucial mineral for shrinking an enlarged prostate and balancing male hormones? It's vital in preventing testosterone from being converted into estrogen, or DHT, by inhibiting enzymes like aromatase and reductase. By doing so, it helps correct hormonal imbalances that contribute to the enlargement of the prostate and reduces its inflammation. To make sure you're getting enough zinc, try incorporating whole food sources like crab meat, oysters, beef, chicken, pumpkin seeds, nuts, beans, watermelon seeds, organ meats, and dark chocolate that's sugar-free into your diet. Another option is to consider taking a daily supplement of 30 milligrams of zinc bisglycinate. Just be cautious not to exceed the recommended dosage, as excessive zinc intake can deplete your body's copper levels. So, if you're planning to take a zinc supplement, it's advisable to include copper as part of a blend of trace minerals too. Number 6. Lycopene. Did you know that there's a vibrant red pigment found naturally in lots of fruits and veggies? Think tomatoes, watermelons, and papayas. The red pigment they have is called lycopene, and it's not just any pigment. It's a powerful antioxidant that helps protect our cells from damage caused by those sneaky free radicals. Extensive research suggests lycopene has a bunch of health benefits. For instance, it can help with things like keeping your heart healthy and reducing the risk of certain types of cancer. And for men, it might even support prostate health by lowering the chances of prostate cancer and easing symptoms of an enlarged prostate. Of course, the best sources of lycopene are the ones we mentioned, especially cooked tomatoes. In fact, it's recommended that you cook tomatoes before consuming them because it increases your body's capability to absorb lycopene by 4 times. Supplements offer a convenient means of obtaining your daily lycopene intake. They come in different forms, such as gummies and capsules. The daily dosage for lycopene that's recommended for men varies, as it will depend on the specific supplement and its intended purpose. But ideally, it should range from 10 to 30 milligrams per day. And here's a bonus tip. As you add foods rich in these nutrients on our list to your diet, make sure you pair it with regular exercise. High-intensity interval training, or HIIT and yoga in particular, are said to be beneficial to men who have BPH. Here are 2 more videos you may find interesting. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos like this, subscribe to the channel.